Good afternoon, friend. Myself is Rohit Amal Kukate, and today's technical topic is causality assessment. So, the causality assessment of ICSR means Individual Case Safety Report. So, the causality assessment it is an integral component of the medical review process and determines the possibility of an association between the intakes of the drugs and occurrence of the adverse events and the individual patients. So there are the various objective of causality assessment. That is, the first is the to estimate a relationship between the drug and event, helps in the signal detections, evaluate the risk and benefits of the drugs, helping in evaluating the adverse drug reactions, reports in early warning systems, that is in the regulatory purposes. Then the method of a causality assessment, that is there are the two methods of causality assessment, that is the global interventions and the WHO UMC system. So first, global interceptions, it is a process of assessing the causality based upon the clinical judgment of an individuals by or the panel who have expertise in the fields of the specific adverse drug reaction. Then it is a WHO UMC system. This is the system was developed in a consortium with the National Center participating in the program for the international drug monitoring. There are the 6 different criteria of the causality classification based upon the strength of association between the drugs and the adverse events. Then what is the WHO UMC scale? It is a method that is the globally accepted in a particles tools for a detecting unknown and unaccepted adverse drug reactions. The assessment is based on the 4 criteria. That 4 criteria are the time relationship between the drug use and the adverse event. Second is the absence of the other componenting cause, that is the medication and diseases. Then response to the drug withdrawal or the drug reduce, that is the D challenge, and the response or the drug readministration, that is the D challenge. Then WHO UMC assessment scale. The level of the causal association is grouped into the 4 criteria category based on the number of above criteria being met. That criteria are the certain, probable, possible, unlikely, unclassified and unassessable. So the first is when all the 4 criteria A, B, C, D are met. The example is injection site reactions after 30 seconds following a subcutaneous injection. Then a possible when a criteria A, B and C are met, the diarrhea with the ampicillin. Then possible when only a criteria A is met, the abnormal liver function test after taking the antihistamine. Then unlikely, no criteria meet, example colon cancer is diagnosed after the 3 dose of an antibiotics. Then a conditional, the applied when the move of the data is needed to such data is being spotted or early under the examination. Then unassessable, when a information is reported is incomplete or contradictory and cannot be verified, then it is the unclassifiable. There are the methods of the causality assessment is the Naranjo algorithm. The Naranjo algorithm is the question areas for determining a likelihoods of and the whether than a ADR is due to the drug due to the alternative functions. It is assessing a probability of a causing via a scoring system, that is the possibility as definite, probable, possible and doubtful. So there are the various questions in the Naranjo algorithm. That is first question is are there is the previous conversion response to these reactions. If the answer is yes, then the +1, and if no, there is 0, and no and do not know, there is the 0. So second question is, did the adverse event appear in the suspected drug was administered? Third question is, did the adverse event improve when the drug was disconnecting a specific antagonist was the administered? Then fourth question is, did the adverse events repair when the drug was readministered? Then fifth question is, are there is the alternative causes and could on their own have caused by the reactions? Then sixth question is, did the reactions reappear when a placebo was given? Seventh question is, was the drug is detected in the bloods or other fluids in the concentration known to be the toxic. Then eighth question is, was the reactions are more severe with the dose was increased or less severe. Then 10th question was the adverse event are confirmed by the any objective evidence, and that there have various scoring. They scoring are given below, that is a definite ADR is 9, then probable ADR is 5 to 8, possible ADR is 1 to 4, and doubtful ADR is 0. That is the all about the causality assessment. Thank you.